Adolescent pregnancies have become more prevalent, and statistics show that in 2012, 11,420 Australian babies were born to teenage mothers. There is also evidence for a close correlation between low socioeconomic status and high fertility rates in Australia. Socioeconomic status, which is also referred to as low SES, is measured by combining education, income, and occupation, and having a low SES is related to a number of poor health outcomes. This can be due to lower levels of education and health literacy. Stigma occurs when an individual possesses or thinks they possess a characteristic that is looked down on by another group. Young mothers have been stigmatized as being unmotivated, incompetent, and irresponsible parents. These stigmatizations discourage mothers from seeking help from interventions and programs because they begin to believe the labels they have been given. Some of these interventions may include family planning for teens or safe sex practices. And some programs may include financial support, government-subsidized childcare, free parenting classes, or access to a mentor. Studies have shown that 75% of adolescents would be scared to tell their parents about the pregnancy due to stigma associated with teen pregnancy. And sadly, 50% of adolescents stated that their teacher thought the pregnancy was a mistake and that they felt stigmatized by their teachers. If young mothers are stigmatized by teachers, they are less likely to continue with their education, which hinders them from gaining more knowledge and a higher level of education and improving their socio-economic status. Some other stigmas related to teen mothers are dropping out of school, relying on government assistance, and being a single mother. However, these stigmas can be reduced by firstly changing the language we use. For example, we can start using phrases like young mother or young parent instead of teen mum. Secondly, schools could create a safe place for expecting mothers in which they can rest and have a snack if needed. Young mothers could also utilize this room by having the freedom to pump breast milk if required. And thirdly, the school could create a supportive environment for young mothers that ensures that they are motivated to finish school. This could be achieved by creating strong bonds between teachers and students and ensuring that young mothers are receiving the support they require. All these changes can be achieved by using a strengths-based approach, and an example would be to hold a meeting with young expecting mothers and draw from their knowledge and ideas on how to reduce the stigma they experience. Females have a motherly instinct once they give birth, and it is important that healthcare professionals acknowledge that when interacting with young mothers. A shift of perception needs to take place in order for a strengths-based approach to occur. Seeing young mothers as being in a difficult circumstance rather than risk gives a more positive light to the situation. It shows that with the correct support, they are able to achieve greater outcomes. Young parents need to identify their personal strength and be encouraged to achieve more and reduce risk. By using a strength-based approach, young mothers are more encouraged to use interventions because they would feel more valued. The correlation between low SES and higher fertility rates is very strong. This shows that young mothers are more likely to have less education and a lower income. Due to the stigma associated with both low SES and adolescent pregnancies, mothers may be more reluctant to access services within the community because they may feel shame or they may not have the health literacy required to access these services. Education plays a very important role in health, as consumers of health need to have the knowledge required to access these services.